Hi, welcome to the practice. We're very excited to have the opportunity to help you, and thank you for trusting us with your health. So the first thing that I want to do today is explain how we're going to use low-level light therapy. So the device that you're going to be given is the TheraRay. TheraRay is going to come in a box like this, so I'm going to go ahead and unpack it and show you how it works and how to use it. So when you open the box, you're going to see several things. This is the device itself. There is some literature in here. One of these is a warranty registration card. Fill that out, send it in. The next is kind of a quick start guide, and then there's some user manual instructions in here. We're going to give you both printed and video instructions, so we want you to follow the instructions that we give you, but these are a nice guide in starting out. So with the TheraRay device, first thing that we're going to do is assemble the power cord. Power cord is going to come out of the box, and it's going to assemble pretty simply. So this end goes in right here like that. This end is going to go into the hole here that has the screw connection. Just screws in tight like that. And you plug it into the wall. There's plenty of cord to go a long way. So with the TheraRay, there is a button on the back. When you push that button, it's going to activate the LED lights in there. So you've got red light and infrared light both. The device will go for roughly about 30 seconds. So let's talk about how we're going to treat and the dosage we're going to use. When you do this, you're going to be skin on skin. So you don't necessarily have the device right up to your skin, but just off it a little bit. So the first area we're going to treat is the bottom of the foot. So with your bare foot, you'll come up here, put it on the foot like this, the forefoot preferably. You're going to hold it just a little bit of ways, hit the button, and you're going to treat directly onto or directly at your bare foot. That's going to go for about 30 seconds. When it shuts off, I'm going to have you go ahead and do the exact same thing on the top of the foot until, of course, the light itself times out. If while you're doing it you notice it gets a little hot, it's okay to back it up a little bit. But generally just about a centimeter or so off the skin. So we're going to treat the bottom of the foot, the top of the foot, then we're going to come right up behind the back of the leg and do a treatment there. And then you'll repeat that on the opposite foot, and then the last area that we treat is going to be right across the small of the back, right here. Again, bare skin back there, and you can hold it just like this, hit that button, and let it go until the light times itself off. If you're treating your hands, hands are very simple. You're just going to go ahead and place your hand over the device like that. Again, activate the light until it times out, and you'll do that on both the left and the right hand. So that's the light device. You're going to be doing that twice per day. The only caveat is when you first start out during your first week of care, we're not going to treat the bottom and the top of the foot. We're just going to start with the bottom of the foot, and then after 1 week, we'll go ahead and add the top of the foot in as well.
On each side, make sure they're just in the water. Your feet don't have to be touching them. And then you're going to get your gloves. So this is going to be your conductor gloves for your hands. And what you're going to do first is you're going to get just a regular water bottle and spray the inside just to make it a little damp, and on the outside. And then you're going to connect the other lead to the glove itself. So there'll be a little black piece here. You're going to slide that in again. And sometimes you have to twist it around a little bit. So once you spray with water, you'll use that conductor spray, like I said, to spray the inside, the outside, just to make them damp. You're going to put your hands in. Sorry, you getting there? And then you're going to turn the unit on. So you'll turn one side on, it'll be for your feet, and the other side will be for your hands. You never want to go past a 5. Even if you're not feeling it, it's still working and still sending that signal from your brain to the nerves. So you want to just set that on 5. Your hands might not need as much. You can always make that a little lower. And you're going to run that for the first 2 weeks. It'll be for 15 minutes. And then after that, it'll be for 30 minutes, 2 times a day. Once you're done with that morning session, you'll want to just lay these out on a towel and then lay your pads out on a towel just so they dry out, and dump that water out. Make sure you turn the unit off each time you use it so it'll save your battery, and then it'll reset. Gloves, once a week you want to rinse these out. So everyone usually has a sprayer over by their kitchen sink. You're going to disconnect the lead, and you're just going to rinse this with some warm water, not hot water, just warm water. Just spray it down. You'll see maybe like a residue come off. That is from the conductor spray because this is salt based. And what you want to do is you can just kind of go down and glide so you get some of the water off, but you never want to wring these out. You never want to put these in the washer machine either. There's wires in here, so you don't want to damage those. Once you've rinsed these out, just let them lay and dry. About once a week you want to do that. Make sure with the unit, you never get the unit wet. It's very important that this unit never gets wet. Of course, your pads and your gloves will have the water, but make sure this always stays dry.
Hi guys, I'm going to show you how to use your nerve plate. You should have received it in the mail by now. When you open it up, you will just plug it right into a wall outlet. From there, you can turn it on with the switch on the back. It'll light up red. And then what you're going to do is rest your feet on top of it. Wait about 30 seconds and it will go ahead and turn on. You'll feel it. We want you to do this at least 3 to 5 times a week for approximately 10 minutes.
All right, so now it's time to learn how to use your Neuropathy Premium Nutrition Support Kit. So it comes in a nice little box like this, and you're going to open it up. First thing that you're going to notice is there is a guidebook in here. The guidebook is going to tell you exactly how to take each one of these nutrients and what those nutrients are actually being prescribed for. So if you look in the guidebook here on this page, page 6 and page 7, it's going to list those nutrients and how to use them. Also in the guidebook, page 9, 10, 11, and 12 are going to talk to you about what type of nutrients that you put in your body that can help you recover faster and get your body healing better, and what type of nutrients can actually be negative and slow down the recovery. So pay attention to this. Everything you need is in this guidebook. If you're a person that likes to do things by paper, there is a daily checklist. It'll tell you exactly what you need to do when you check this off. Otherwise, we'll be keeping track of this electronically. So on to the products. This one right here, this says Vaso Pro Plus. This is a pink powder. There's a scooper in here. You'll take 1 scoop of this twice per day. This one, these are neuroprotective greens. It's the greensberry drink. There is a scoop of this. The scooper sizes are different. You'll do 1 scoop of this twice per day. Most people will take cold water or juice. If you're diabetic, make sure it's a juice that's sweetened with stevia. If you're going to do a low sugar juice, you'll take 1 scoop of this, 1 scoop of this, and you can mix that together and drink that. And you'll do that again twice per day. A lot of patients prefer the taste of it if it's been refrigerated. So if I'm taking this in the evening, I've already made that after I took my morning dose. It's sat in the refrigerator, so it's nice and cold. Next thing here you have is Inflamex. Inflamex helps to reduce inflammation. This is a homeopathic extract. You're going to take 2 dropperfuls, not the whole pipette, but 2 squeezed bulbfuls. 1, 2. You're going to take 2 droppers full of this in your mouth. If you want to do it under the tongue, you can. If you want to put it right in the same drink that you make, go ahead and do that. But I need 2 dropperfuls of this done, the Inflamex, twice per day. Last but certainly not least, there is a topical here called NeuroSoothe. This is going to contain a little bit of menthol. It can help to calm down some of those aggravated nerves, but it is a topical vasodilator with arginine, so it's going to help to open up those blood vessels, get oxygen and nutrients down to those nerves when they're aggravated. So a little bit of this goes a long way. A pea-sized drop once or twice per day can really make a difference, especially, if you have trouble sleeping at night, you'd want to do that right before you went to bed, or if your neuropathy wakes you up at night, have this by the bed. Word of advice on this, because it has menthol, you want to make sure you wash your hands before you touch your eyes, use the bathroom, or anything like that. Folks, that is the Neuropathy Nutrition Support Kit. Easy peasy.
Hi, I'm Taylor. I'm the health coach here at Aligned Health and Wellness. As you begin your peripheral neuropathy program, I want you to know that you're not doing this alone. I'll be checking in on you every 2 weeks for your coaching calls. These calls are a chance for us to connect, talk about how you're feeling, and make sure that you're comfortable and confident with your treatments and supplements. We will also go over dietary recommendations and talk through what to expect as your body begins to heal. If you ever have questions, concerns, or run into any challenges along the way, that's exactly what these calls are for. My role is to support you, help keep you on track, and make this process as smooth and successful as possible. I'm here to help you get the most out of your care every step of the way. I look forward to working with you and being a part of your healing journey.